Hi everyone! This video will help you identify common gait patterns and understand basic gait management for nursing practice. Gait is the manner or pattern of walking. Changes in gait can indicate neurological, muscular, or skeletal problems. So we have types of gait. First is the normal gait. It is when a person can walk with a smooth and coordinated gait. Waddling gait causes you to exaggerate the movements of the upper body, which creates a duck-like walk. The body sways side to side because of weakness in the hip muscles. Antalgic gait is common in rheumatoid arthritis. This makes you limp to avoid steps with or putting pressure on your affected leg or foot. The patient shortens the time on one leg to avoid pain while walking. Spastic gait. It is common in disorders like cerebral palsy, multiple sclerosis, or hemiplegia. This causes you to walk with one stiff leg, so walking is stiff and tight due to the increased muscle tone. Parkinsonian gait. Common cause of Parkinson's disease. Its characteristics are when you have a propulsive gait, including a stooped, rigid posture, and your hands are shaking. Steepage gait. It is common in people with amyotrophic lateral sclerosis, multiple sclerosis, and Parkinson's disease. This causes a high step where you elevated your hip to lift your leg higher than normal. Scissoring gait. This gait is common with people who have spastic cerebral palsy. It is when your knees and thighs hit or cross in a scissors-like pattern when you walk. It may be slow or small. Circumdoctory gait. This is commonly seen in people with a history of stroke, and its characteristics include when the patient holds her hands to one side and drags her affected leg in a semicircle due to the weakness of distal muscle. As nurses, proper gait management is important to prevent falls and promote mobility. First, assessment. Observe walking pattern, balance, posture, and use of assistive devices. 2. Safety measures. Ensure a clutter-free environment and assist the patient when needed. 3. Assistive devices. Use canes, walkers, or crutches appropriately. 4. Patient education. Teach proper posture and safe walking techniques. And lastly, 5. Referral. Coordinate with physical therapists for rehabilitation. So why is it important to know these gaits? Understanding different gait patterns is important because it helps us recognize possible neurological or musculoskeletal conditions. By observing how a patient walks, we can identify signs of disease like stroke, Parkinson's disease, or nerve injuries. It also helps us plan proper care, ensure patient safety, and prevent falls or further complications. Thank you for watching. Stay tuned for more nursing tips.